Is National Minority Health Month, and experts say Black and Hispanic adults are at a greater risk of memory loss than white people. It's why the University at Buffalo and the National Institutes of Health are doing a study to see if nicotine can actually help with memory retention. They're conducting a study using nicotine patches, and right now they're looking for people who are 55 and older, particularly people who are Black or Hispanic. Joining us live now is Clinical Trials Associate Blake Wilson. We appreciate you being here. And first of all, we were showing video right there of people smoking. That's not what this is about. You don't want the nicotine from smoking. This is about the patches. But I wonder if you can walk us through, because we hear nicotine and memory retention, and it's like you don't think the two go together. But apparently there is some evidence that precedes this study, which is exactly why you're looking into it, right?
Correct. So we have been using nicotine in research for over 30 years. Nicotine is very common in a lot of foods and fruits and vegetables that we eat every day. So potatoes, tomatoes, eggplant, all contain trace amounts of nicotine. And so in this study, we are using nicotine patches as a potential cure for mild cognitive impairment.
We mentioned how the University at Buffalo is one of the partners in this. I know that there are some sites all over the country where people can sign up and be part, and you really need a diverse group of people, diverse in many different ways, to make sure that you're capturing the right sample, right? So you get the right results. Tell us what people should know who are watching right now, especially people who are Black or Hispanic and who may be interested in signing up and being part of this.
Correct. So we know that African Americans are a 2-time greater risk when compared to white adults in developing a memory disorder. So in this study, and you can find out more information about the MIND study at mindstudy.org, and you can find a location that's close to you, one being the University at Buffalo. But we are looking for participants because we know that our research would not be complete unless we have a wide selection of people. And so in order to do that, and especially with today also being World Health Day, we want to stress the importance of minority participation so that when we find a cure for this disease, we know that it's representative of the entire population because we have tested everyone.
And Blake, for someone who's watching right now for whom this piques their interest and they want to be part of it, what will it look like to be a participant in this? I mean, what type of commitment should someone expect to have to be part of it? What is it going to be like on them if they're able to be a part of it?
So the MIND study is a very simple, or I should say easy, non-invasive study. It's a 2-year study with study visits about once every 3 months. So we supply all of the nicotine patches. We supply all of the products for the study free of charge. But what's great about this study is that it's easy to do. So you would put a patch on in the morning, you would wear it all day, and then you would take it off in the evening. So it's great if you're on vacation, you can still participate in the study because all you have to take with you is those nicotine patches. So like I said, we are looking for people and people of all races and ethnicities, 55 to 90 years old, who've either been diagnosed with mild cognitive impairment or who are experiencing some memory loss.
And finally, Blake, I've got about 30 seconds left here. Tell us the website again, so for someone who wasn't able to write it down right there, and then once people go on the website, how easy it is to sign up and how that'll work out for them.
Yeah, it's the mindstudy.org, and you can just go to the site, go to location, search for a location near you, and click sign up. And you will fill out a short little information, and then that will go to the site.
And then again, while this is a national study funded in part by the National Institutes of Health, UB is one of the partners in this. And again, they're looking for people right here in Western New York to be a part of it. When we saw using nicotine to help with memory loss, we were kind of like, what? But the more you look into it, the more you see all the science that kind of backs this up. So it's going to be fascinating to follow it. Clinical Trials Associate Blake Wilson has been our guest. Blake, thanks so much for taking some time for us on a Friday.
Thank you so much. Have a great weekend.